So again, as you're joining, if you are joining, please do share your name, which organization you're from, and where you're located. That information would be extremely helpful to us. All right, so we're going to get started. As I said, today our topic is going to be focused on education, healthcare, and really how it is impacting or some of the changes that has taken place and its implication for the justice impacted workforce. And today we are really excited to have Randy Mandana from the Jobs for the Future Center for Justice and Economic Advancement. And hey, Brandy, welcome. Really excited to have you today. Thank you so much for giving up your time. You know, one of the things that I learned about Brandy recently, she has a heart for a community. She's really committed to serving, even if it means sacrificing her own time. So she has some significant things that she's doing in our state. We're not going to necessarily go into it, but I must say I've been so impressed with Brandy's work and our commitment to really serve our community. And this is an example of what we mean, right? She's giving up of her time to really invest time in continuous learning here to share her expertise and to facilitate this conversation. So Brandy, it is my pleasure to hand over to you. I know you can give a much better introduction to yourself and also to your panelists. So thank you, Brandy, for joining us. And thanks everyone for being here today. Brandy.
Thank you so much, Jason, for that warm introduction. It is such an honor to be here today and in conversation and community with all of you. I'm Brandy Mandato. I'm a Senior Director with Jobs for the Future Center for Justice and Economic Advancement. We'll talk a little bit more about that in a second, but I also am so grateful to be joined by incredible colleagues, John Sawyer, who's a Senior Consultant with Health and Reentry Project, and Amanda Nowak, who is a Senior Program Associate with the Vera Institute of Justice. So thank you both so much, John and Amanda, for being here today. Let's go to the next slide. So very, very briefly, I'm going to do some table setting for today's conversation. We'll talk a little bit about the Center for Justice and Economic Advancement, and then we'll get right to the Normalizing Opportunity Policy Framework. The Center for Justice and Economic Advancement was launched at Jobs for the Future a little over 2 years ago under the visionary leadership of Dr. Lucretia Murphy. And our approach is that every person with a record should have a fair chance to secure a quality job and a better life. And we do that by breaking down systemic barriers and enacting fair chance employment for people with criminal records while driving economic advancement. Next slide. I wanted to take a minute and talk about our approach. Our approach is deeply informed by the expertise and experiences of people who have been directly impacted by the criminal legal system. So at every intersection of our work, at every level, we have folks on our team. I have colleagues who are currently incarcerated who are driving this work, informing this work, and implementing this work. And that is core to why we exist and critical to our mission. Next slide. I wanted to take a second to just sort of illustrate what the ecosystem looks like in our world. So we work with everyone who has decision-making authority, investment in, and a desire to change the world for people with records. And so it is a really holistic approach. We focus on economic mobility, but we want to make sure that we're bringing together all of the right stakeholders. Next slide. So how do we do this? We do this through key impact areas, talent development, things like post-secondary education in prison. We have a normalizing education collective, really helping folks get smart and thoughtful about education, high quality education and training for people that are incarcerated and people with records. We work directly with employers to drive employer change and scale fair chance employment. And then I oversee our policy and systems change work, where we work with local, federal, and state policymakers to think through the right levers to ensure real opportunity and mobility for people with records. And those are upheld by a robust research and evaluation agenda and narrative change and advocacy work. Next slide, please. So here it is, the Normalizing Opportunity Policy Framework. This framework was developed, it's not just this, it is many, many pages. This is a slide that sort of gives the high level overview. This was developed in community, in partnership with leaders in the field who have been doing this work for generations. As we were developing this framework, really did it in community to ensure that it reflected the full breadth of policy levers required to really drive economic mobility. So this is what we know works for economic mobility, and it's contextualized for people with records. Woven into this framework, really intentionally, are the voices of people that are directly impacted. And featured is Amina Elster. If you don't know Amina, I promise you, you want to. She is a fierce advocate, a subject matter expert, and a CEO. She acquired 2 associate's degrees and a bachelor's degree from UC Berkeley while incarcerated, thanks to State Senate Bill 1391 of 2014, which removed barriers preventing programs from compensating community colleges for teaching face-to-face courses in prison, and from offering incarcerated students the same services that were offered to students on campus, such as tutoring and academic advising. She was able to leverage the California College Promise Grant, which provides tuition coverage for all students enrolled in a California community college who qualify as low income, regardless of their incarceration status. Thank you to the Feather River College's Incarcerated Student Program, or ISP. She was able to gain admissions to a number of colleges and universities within 8 months of being home. She was also able to secure housing through the San Francisco Fair Chance Housing Ordinance, and was able to get support overcoming nearly $100,000 in criminal justice debt, blocking her way to upward mobility. So when we look at stories like Amina, the way that policy allowed her to flourish and held her back are important to reflect on as we think about the implementation of these policies. Okay. So today we're going to go deep on healthcare and education. And so within this normalizing opportunity framework, which is really comprehensive, I want to call out specifically 2 of the pillars. So supporting education, skills, and career navigation, and ensuring foundational economic mobility supports. So when we're thinking about educational policy, we want to make sure that it's policy that expands access to education, that strengthens pathways to careers and credentials, and that integrates work and learning. And we're thinking about the critical necessity of healthcare. We want to make sure that we're promoting the formation of community and regional partnerships and eliminating barriers to access for those resources to support reintegration into the community. So just keep an eye out for all of the ways that we're thinking about how education and healthcare drive economic mobility. And so with that sort of setting, I'll kick us off with our first question. And this is for both Amanda and John. And Amanda, I'll ask you first. What are changes that have taken place in Pell Grants, and what is the bottom line for people who are impacted by the justice system?
Yeah, thank you so much, Brandy, and I'm very happy to be here. I specialize in Pell and everything related to connecting those dots between education and employment. So a little bit about the changes that have taken place. So to do that, I have to go back a little bit all the way to 1994. Prior to that, there was college access. People were able to tap into Pell Grants while they were still incarcerated so they could more easily earn a college degree. But with the 1994 crime bill, college education and using those federal grants was banned for people in prison. Then flash forward to 2016, the federal government started allowing Pell Grants to be used for college classes while incarcerated again. It was a very limited capacity, and this was under the Second Chance Pell experiment. Luckily, the experiment was deemed successful. So now we're at the point in our history where Pell has been officially reinstated as of about exactly a year ago, coming up on next month. But with this reinstatement, however, the federal government has wanted to ensure that these programs are going to be of high quality. So they can't be watered down, they can't be predatory in any way. So there are many regulations that come with Pell reinstatement. I'll go into a bit more about what these requirements are later in the session. So I'll pause on that front, but just to say there's a lot of regulations at play in order for people who are incarcerated to access college. But the bottom line for people who are impacted by the justice system is that now, for the first time in many, many years, many people who previously had no access to post-secondary education will now have that access. This opens so many doors to not only educational pursuits, but also to career opportunities and advancement as well.
Thanks, Amanda. John, can you talk a little bit about the changes to Medicaid and again, that bottom line for people that are justice impacted?
Absolutely. Thank you so much, Brandy and Amanda, Jason, Kimberly, and the NRWC team. It's really great to be with everyone today. And thanks to everyone who is taking their Friday afternoons, or maybe for some of you on the West Coast mornings, to join us here. I'm going to throw a couple of quick slides up because I think they just help give a little bit of context. I'm not going to try not to overwhelm you with too much detail, which can happen when we talk about Medicaid. But just as Amanda talked about, there is sort of a shifting landscape on healthcare, similar to what's happening on education. And I think it's really important that all of you are sort of aware of this and starting to understand what the potential benefits are. So at a national level, but also at a state level, because Medicaid, which is the largest health insurance program in the country and primarily for low-income people, Medicaid is jointly run by this federal and state government. Medicaid's taking another look at how it provides services when people are incarcerated, and especially as people are reentering communities. And just as Amanda backed up to the early 90s, I'm going to go even further back and back up to the mid 60s when Medicaid was first created in 1965. And at that time, a provision was put in the law that basically said Medicaid cannot pay for services that are provided while people are incarcerated. And that was for a number of reasons, including, stigma, but also because of the division between responsibilities of local, state, and federal government. But it's created real barriers over time for people as they get out and as they're incarcerated in accessing healthcare. And so the goal in people looking at potential changes here is not just improved access to healthcare and improved outcomes, especially around substance use. Those outcomes are dramatically worse for people who've been incarcerated. But there's also public safety goals that are, downstream of that around reincarceration, recidivism, and rearrests. And so you can see on the slide here that within these changing policies, youth are an important population of focus. And so the two things that I'm going to talk about a little bit, and I just want to go over them quickly, are one, a national policy change that's coming next year that begins to open the door to Medicaid coverage of services for youth as they're leaving incarceration, but importantly allows for coverage of those services pre-release. So I won't go through everything on the slide here, but just to say, importantly, these changes, when they go into effect, apply to the Medicaid definition of youth. There's a bunch of people in the chat working with the sort of emerging adult population, 18 to 24. And so this does apply to all Medicaid eligible youth under 21. And in the case of former foster youth, it applies to everyone under 26. And what this allows for, and actually in the case of the first policy actually requires states to provide, is screenings, diagnostics, and referrals to services for youth in the period before or shortly after release, and then case management in the 30 days before and the 30 days following release for those eligible youth. There's also a component of this policy that is an option for states that can go beyond that sort of immediate reentry period and start using Medicaid to cover services before, just as youth are before disposition of charges, so pre-trial, pre-adjudication services. So this is a big opportunity for youth. It's also a big lift for the justice system to start implementing changes that will allow Medicaid to cover services. So that's the national scope. There's also a lane of state-specific changes that are happening under what are known as Medicaid reentry waivers. And this is a program under Medicaid that the federal government has sort of laid out rules of the road for states as they want to use their Medicaid programs to begin covering services for people who are incarcerated and returning to communities. So at a basic level, states can begin, under these waivers, can begin offering coverage by Medicaid for services in up to 90 days before someone is released. This has big implications not only for those transitions in care, but also for the quality and the access to care that people receive in prisons and jails. States at a minimum have to cover 3 services that are listed here: case management, medication-assisted treatment for substance use disorders, and provide a 30-day supply of prescription medications at release to facilitate those changes. And we're at almost half of states now have applied to the federal government to make this change. We know more are on the way. And 4 states, California, Washington, Montana, and Massachusetts, have actually seen their reentry waiver proposals be approved. And so they're moving on to implementation. One important thing to note about this is that because Medicaid will be coming in, some of the resources that have been spent on these transitions and healthcare services will get freed up. And so those freed up resources have to be reinvested in the community and in access to care for people who are returning to communities. One last thing that I just want to mention before turning it back is there's also a new policy and funding opportunity focused on community health centers. I know many of you at the community level probably partner with your local community health centers or federally qualified health centers, and their federal government agency has provided new policy trying to align with sort of Medicaid in terms of what they can provide pre-release and what kinds of services they can put together as people are returning to community. They've also put together a funding opportunity for those community health centers that will be about 50 grants of almost $1 million each. That application for those health centers that are providing it is due on in about a week, less than a week. And so just know that some of your community health center partners may be expanding their activities in this space. So just in terms of the bottom line, we'll talk more about this, and I'll actually stop sharing my slides for now. But I think, you know, the bottom line for people who are incarcerated and who are returning to communities is it's a really high risk time, reentry. The health outcomes are a big challenge. And, you know, we know, and you all know better than I do, that healthcare is not necessarily always someone's top priority. And so making healthcare as seamless and as making as many warm handoffs directly to healthcare services, but including by starting those services and payment for those services ahead of when people are released. That's the real goal here, is to give people an extra way to get back on their feet as they return home. So looking forward to the rest of the conversation. Hope that wasn't too much. There's a lot more of this kind of detail on HARP's website, which we'll, I'm sure, share along with everything else.
I think that was perfectly timed. I felt like I could have spent 2 hours on the normalizing opportunity policy framework, so I know how hard it is to rein it in. Really appreciated the map view that I think gives us a sense of where work is advancing, where there's some things happening, and then where we've got some work to go. So really appreciate that, John. Amanda, there are a number of folks joining us today that are practitioners or other invested stakeholders, and they work with participants who are interested in taking advantage of these opportunities. What are some of the things they need to keep in mind when advising folks?
Yeah, thanks, Brandy. That's a really great question. So the first things first is that there is a very rigorous approval process to becoming a prison education program. A prison education program designation is what the Department of Ed gives you that actually allows you to tap into those federal funds. So any individual cannot just apply for any college program while they're incarcerated and get those funds. So it's very important to just recognize that while this opportunity is now available technically for everyone, there's a lot that has to happen in between on the college's end and corrections end in order for those funds to actually become accessible to students. So it's not an overnight thing. It can also, as things start to enroll, it might not reach a facility that someone is in for years, possibly. Obviously, we don't want that to be the case, but we're already a year into implementation technically, and there are a very, very small handful of programs that have been approved to date. And that's just because the process for approval is so rigorous. Corrections has to give a level of approval, the college's accreditor has to give a level of approval, and then it sits with the Department of Education. They have to give an approval, and each of those steps can take months. So just to keep that in context when we're advising individuals on the options that they have, I do wholeheartedly believe that every individual will have this access at one point in time, but it's going to take a while. As it rolls out, the individual you're working with might have one college option. They might have multiple options or multiple majors or degrees they can, they can earn. So one of the things when it comes to advising them at that stage in the process is giving them the tools and resources that they need to make their own informed decisions. That's going to be huge. So I mentioned earlier that there are these new requirements. So I just wanted to quickly mention those requirements in the greater context. So previously, no requirements when it comes to whether your credits can transfer or the quality of faculty or whether students, if they get released mid-degree, were able to continue. Some actually, the college denied them because they didn't want them on their campus. There was no requirements on advising. So I'll walk through the 4 requirements and then we can go from there. So first is that the courses and faculty that the college is providing on the inside has to be comparable to the courses and faculty on the outside. The second requirement is that credits have to transfer in the same way. Previously, some of the watered down programs we've seen is, it's this sort of like makeshift, I don't want to say not real degree because it was a real degree, but it would be a little more loosey-goosey, like they kind of pick and choose classes and make up their own degree because of the limitations of the correctional facility. That can no longer happen. Also, career and academic advising are now required at least once a semester, ideally more. And there has to be a special emphasis, especially in advance of reentry. So for the first time, we're starting to see this reentry component as part of prison education programs. And then lastly, students have to be able to continue their enrollment post-release at any college location. So we've seen so many times students get denied, continued enrollment, or they'd have to reapply and check the box that they've been incarcerated and get denied because there was no obligation from the colleges to continue their enrollment. But now that is not the case, and colleges are now in a position to have to continue the enrollment. So students are going to be coming to campus. And so luckily, the advising is required, and I don't think that it takes necessarily a heavy lift of probably many of you in the audience because the colleges should be taking that role on. But I will say this, there's a caveat to that colleges and corrections are new at this, and they're not informed on licensing restrictions or reentry or trauma-informed this and that and what the students may need. And so this is where we're encouraging that training to happen. And this is what many of you in the webinar today can take advantage of to make those connections with colleges and corrections, to make sure that those who are required to do the advising can do so in a very intentional and informed, coming from that informed place. So I'll be talking a little bit more about later on what that could possibly look like, but that's the advising piece. It would be fantastic if there was sort of that train the trainer approach in the advising that you might be looking to do. Thank you.
Thank you, Amanda. it's so helpful to hear that so many leading practices and so many of the things we've been fighting and advocating for are now being reflected, and it takes time now because of that rigor and because of that quality assurance. Really appreciate that context. John, can you answer the same question? So in terms of practitioners and stakeholders that are advising folks who are interested in accessing these new services, what's your guidance there?
Sure. I think in terms of community-based organizations in particular, there's such an important role to play, because I think as we start to think, if you think about healthcare as it's been provided in prison and jail historically, and then you think about these changes as sort of a first step towards, in the ideal world, better integration of that healthcare system with the healthcare system in the community, and really with the goal that people receive the healthcare they need in the community, both before incarceration and as they're returning to the community and once they're home. Community organizations that have worked with this population for many, many years and decades are like a really important connective tissue here. You have the trust, those of you who are working with those organizations have the trust of the community, you have the credibility. And so I think one place to start is starting to connect with both local healthcare providers and with your state Medicaid agencies, to say, what is our role in this? And here is the role we'd like to have in terms of potentially even being the provider of some of these case management and other services, as Medicaid is playing a larger role. Those may be things that folks are providing in the community already, but they may be doing it, through grant funding. They may be doing it in sort of more of a piecemeal basis. And so I think the one word of, not caution, but I think similar, Amanda, to what you were saying, of like a thing that is going to take some time to build over time is the capacity of community-based organizations who've mostly focused on reentry service provision, to begin to work with Medicaid. That's not a small lift. There's some administrative overhead that's involved. It's a change in sort of the mentality of, how services are paid for. So those are some of the costs, but the benefit is, over time, Medicaid offers the promise of sustainable funding. So it's not the kind of thing where, once it's working and once services are being provided and reimbursed, you don't have to then apply for that new grant every single time. It's, a more sustainable system, and it's a system that can scale as additional people are made eligible or additional benefits are added. And so, I think that and I'll probably come back to this over and over, is like just starting to educate yourselves, starting to raise awareness of the services you provide with the healthcare stakeholders who may not know, just to Amanda's point, may not know the world of reentry, may not know the landscape of who's providing those services on the ground. You want to be at that table early so that they're not accidentally replicating what you're trying to do, because they just didn't know that it was happening. So I think that's where I would start.
To your earlier point about healthcare not being sort of the first thing folks are thinking about when they come home, I think I am way more likely to call and schedule that follow-up appointment if there's a clear and easy path to do that, and I know that I'm going to get approved for those services. And so I think this continuity of care is so important, and particularly as people are gearing up to rejoin the labor force, medical issues can absolutely be an impediment in doing that. And so thinking about this holistically, ensuring that we're connecting folks to good care, both physical care, mental health care, substance use care, all of that is so important, because we are, supporting whole human beings and not just workers. And so,
so just to build on that for a second, Brandy, I think one of the nice things about, for instance, the community health center piece of this is those community-based healthcare organizations already have a long track record of helping connect people to other services, transportation, housing, nutrition, employment-related services. And so there's a potential here, again, not to replicate anything that folks are doing, but to have the healthcare system with support from Medicaid be kind of a hub where people can, both sort of access the healthcare services they need, but also be connected to so many of the other services that we know are so important for people's health and stability.
Really great point. I also think about what it means to have informed care by practitioners that know what it means to be transitioning back home and know that you likely didn't get the care you needed when you were incarcerated. And so being able to understand the nuance there and make those connections just feels like such a trusted place to land. So really appreciate that. And then Amanda, I mean, I think the connection between, economic mobility and high quality education is so clear, and so grateful for all the work that has been done to really advance that. And it's why it's one of the key drivers in this policy framework. And right next to it is that employer change piece, because we need employers to change their policies and practices to really take advantage of what more and more is an incredibly skilled, incredibly competent talent pool. So thank you both for making that connection. Continuing that conversation around continuity of services. So to transition from pre to post release is absolutely critical in terms of reentry success. We talked a little bit about this already, but can you talk a little bit more about how increased access to Amanda Pell will support individuals during that critical transition and how it could and will impact job seeking?
Yeah, absolutely. So like I mentioned, now advising, especially in advance of reentry, is required in order for schools to offer college programs in prison and use Pell funds. So students are entitled now to this new layer of support that they previously and unfortunately did not have before. The other requirement that now we're seeing is students can continue their enrollment. But I want to point out that just because they're allowed to continue their enrollment, that doesn't mean they're going to get all of the services they need from colleges. There are very few colleges that allow students to reside in the residence halls, for instance, and housing still remains to be one of the largest issues of people reentering. I would personally love to see this change, but also just at minimum, students will they'll still be able to be a part of the campus community. And there's such a huge untapped resource in and of itself. I know that there are few colleges that do have like an office for reentering students, or like a student-driven club for reentering students. And we've seen that have really powerful effects because students are struggling as they transition. You still, at the end of the day, have those same housing, food, transportation struggles. And so now colleges are in a position to help more, although I don't think that that's really on the forefront of their minds. And so this is going to be a huge area that we really need to kind of drive home for colleges, because it's still not, just because they're allowed, they don't have to, do these extra things to actually make the students be successful in college once they return home. And then with respect to job seeking, again, there's that extra layer of career advising that wasn't there before, but there's no guarantee that the people advising the students will be prepared or trained to properly advise them in good jobs with low barriers, keeping licensing restrictions in mind, keeping their limited maybe technology skill set in mind, and things of that nature. There's a lot that needs to you need to understand when you're working with this population. And finally, you are trying to guarantee a comparable experience inside and outside. And so students on the outside are entitled to internships, pre-apprenticeships, other professional development experiences. And so it's also important to think about how can that be incorporated on the inside, because while it's not explicitly stated, it is factoring into that requirement of offering a comparable experience. And I think that a lot of, corrections, even colleges sort of shy away from that because they think all of the limitations make that impossible. And that's just not true. There are many documented instances where people are making a full living wage while incarcerated. And I want to get that message out. That's a huge connection to improving employability in the future upon release. I do have some tips for how community, I know we're short on time, so how CBOs can get involved in this process. Although the career advising piece is a requirement for colleges, there's no requirement that says the college has to be the person to offer this career advising. So in terms of what CBOs can do is make that conversation with the college. I know that there's at least one instance where the college is contracting out their career advising to a CBO because they recognize that they're the experts in that, and the college just doesn't have the capacity to become an expert. But also CBOs can offer their subject matter expertise and maybe establish a training opportunity to those colleges who are doing the work, because I do believe that's the majority of colleges are going to end up being a part of that. And then lastly, the last thing I just want to add quickly is there is a requirement for CBOs to evaluate these college programs after 2 years to determine whether the colleges are meeting all of those new requirements. Corrections oversees that evaluation, but they do have to get input from CBOs. So that is another place where CBOs could step in. So I wanted to put that out there because making conversations with corrections or colleges now might actually help you become a part of that process to evaluate whether colleges are operating in the best interest of the students. Okay, I'm sorry, Brandy, I squeezed two answers into one because I know we're short on time.
I absolutely love that, John. I'm going to ask the same to you before we turn it over to Q&A. Recommendations, advice you have for community-based organizations?
Yeah, no, I think the main one is what I mentioned earlier, which is just begin building the connections. I think many of the organizations who are involved here have the connections with the local correctional agencies and correctional facilities. But I think strengthening those, because those folks are going to be in the same kind of way, they're going to be on the hook now to make sure that people who are incarcerated and who are eligible are getting, at the very least, case management services and some of these other services. And just as with what Amanda said, the new waivers do not say those have to be provided by the correctional facility. And in fact, they have to be provided by Medicaid enrolled and Medicaid certified providers. So on one hand, like strengthening those connections with the facilities to share with them and raise awareness about these changes, but then building those connections with state Medicaid programs. And, this is something that at the state level, Medicaid directors and Medicaid staff are increasingly aware of. They know that these are requirements that are going into effect. And frankly, they're looking around for, how do I make sure that this is going to work? And so CBOs are in a good place to come in and say, help me be part of the solution here. I have a trusted workforce that's ready to step in.
Brilliant, thank you. I'm going to open it up to the chat. So Rachel Hampton asks, what recommendations does HARP have for states that have not expanded Medicaid, like Texas, to help enforce this eligibility for pre-release Medicaid eligibility for youth? I tried to pass a bill last year to allow for Medicaid eligibility, Medicaid eligible juveniles currently in custody in a youth prison in Texas to just look for eligibility and enroll them, and it failed the floor. What do we need to be prepared for to help enforce this in our state?
So Rachel, this is a great question. And I want to back up and just explain a couple of the things that you mentioned in your question for those who, unlike me, don't live and breathe Medicaid policy on a daily basis. So the Affordable Care Act expanded Medicaid to essentially the entire low-income adult population. But that expansion was subsequently made optional for states. And so now 41 states have expanded Medicaid to that population. But just as you note, 9 states have not accepted that expansion, including Texas, and as Kimberly notes in the chat, Tennessee and others. And so in the case of those states, the group of folks who are going to be eligible for these changes is much smaller. And so so that leads me to the second clarification around your question, which is that the policy that I mentioned for youth, it doesn't actually change underlying Medicaid eligibility in your state. What it changes is what services can be covered for already and otherwise eligible youth. And so I think that's just one thing to clarify, is that we're not actually changing, in some ways, unfortunately, who will be eligible for Medicaid. We're changing what services will be able to be covered for youth who are eligible. That being said, I think it's still a really good question, which is like the state is going to be on the hook for making sure that youth who are incarcerated, who are eligible for Medicaid, otherwise eligible for Medicaid, who are going to have services covered. And I think the first thing I would say is sort of this is maybe a broken record here, but there is an awareness need here, first and foremost, that this is a federal law, that it affects all states. It will affect Texas differently than it will affect, Michigan or New York, where they have expanded Medicaid. But even if one person is still eligible for these services, otherwise eligible for Medicaid, and they meet the criteria under the youth provisions, the state is on the hook to make sure that they get those services. So I think the first thing I would do is, instead of trying to use a stick, use a carrot, and come in and sort of share with the state that you're aware of these new recommendations, requirements, and that they, you're in a position to help them meet that need. And I think raising that awareness and then figuring out how to start operationalizing those changes is probably where I would start, because I think all states are scrambling a little bit to figure out how to do this.
Thanks, John. Derek, Avery, I think we answered your questions about how we can connect people to these opportunities and where in the US these opportunities are available. But if you have an additional question, please feel free to drop it in the chat. There's a question about how folks can get,
I was just going to say, I'm going to put one thing in the chat. Just Rachel had a follow-up question, and I think what will be helpful is, because the details matter here, so I'm going to put a fact sheet that we have from HARP that's about all of these changes, and I'll link to that in the chat, because I think that's where you want to look at what's going on in your state and where can you start.
Thank you. Other questions? I want to give folks a second to ask. There is a question about getting involved on an individual level. And I don't know if that's in terms of like accessing services or partnering and working with CBOs. So if you could provide some clarification there, we're happy to answer that question. And then Amanda, you gave 2 state examples about where we're seeing some success and where there are some barriers. Can you talk a little bit more about where you see some significant promise, and then where there are some challenges for folks in terms of implementation?
Yeah, absolutely. So where we're seeing, I should also take this opportunity to do a plug for a report that's coming out. I wrote a report. It will be published June 28th. And it basically has 15 different metrics and then sort of rates each metric on red, yellow, green for each state on all of those metrics. And the goal of that is to show where everybody is towards Pell implementation. So some of the trends that I can share that we're seeing from that report is every corrections agency, and so every state DOC, and including Puerto Rico, including the Federal Bureau of Prisons, they all have their application process live, developed, implemented. It's up to the colleges to apply, but that's sort of where we're seeing success and where the country is right now. And we have had a few, so then after that approval, the accreditor has to approve, and then Ed has to ultimately approve. And each of those takes a few months, but we are seeing more and more applications sitting all the way with Ed at this point. So we know that we're moving towards we thought through the basic ideas of our program, we applied, but no one has started yet. Some of the other things that we're seeing that are challenge areas are on a lot of equity pieces. So you might see programs offered for the men, but not for the women. You might see, in terms of racial and ethnic breakdown, a disproportionate of demographics who are actually in education compared to the more traditional prison population breakdown. And we know that that can cause harms in a lot of ways. So it's a call to action to think about programs equitably and take that additional step. Technology is also an area where to increase these opportunities, technology has to improve. And there is a funding source, the Digital Equity Act, you may have seen it, that will allow for funding to be directly invested into correctional settings. So we are seeing these opportunities come about that we're really urging corrections to take advantage of. But essentially, just to answer your question, application phase, great, we're there, but now the actual implementation phase is just slow to come. And I think we'll see a lot more developments over the next 6 months, probably, as programs are getting approved and they're actually having to start their implementation of the programs.
Thanks for that, John. I think your map sort of highlights where there have been some successes. Can you talk a little bit about some of the challenges and how potentially folks on this call can help navigate those?
Absolutely. And I think if you step back and think about what these healthcare policies are really trying to do, I think what they're trying to do is bridge two very different systems in the interest of people and people's health and people's long-term wellness. And so bridging those systems is probably the first and biggest challenge. The healthcare and the criminal justice system speak very different languages, respond to very different incentives, have very different missions in some sense. I think one of the things that's been remarkable as we've been working on this at HARP for a number of years is to actually, when you step back and you get folks in a room who work in both of these systems, you realize how in many ways their goals are aligned, which is that they don't want to see people incarcerated. They want to see people getting back on their feet after they are released, and they see healthcare as a potential lever in doing that. But the challenge, not just from sort of a culture and a language standpoint, although those are big, I think from a operational standpoint and from a data standpoint is a really, really big one. So, making sure over time, one of the things that's going to have to be built here is a way for a healthcare provider in the community to know what healthcare someone got while they were in jail or prison, and vice versa, for someone in the jail who's providing healthcare to know, what medications a person needs when they come in and what they need to set them up with when they go out. That kind of stuff sounds easy, but I can assure you that it is not, both from a technological standpoint and from a legal standpoint. There's a lot of different privacy regulations that rightly are trying to restrict and protect people's information in this case. So that's just one example, I think, of the sort of cross-system building efforts. But again, I think the role that folks on this call can play is you're already the connective tissue between, the correctional system, the correctional setting, and the community. And, you've navigated those kinds of culture intersections before. And so in some ways, this is the healthcare system showing up probably a little bit too late, but I think in an important way to sort of be part of that solution. And I think you can really help facilitate that.
This is why it doesn't sound easy to me. And this is why we, as part of our framework, included the essential infrastructure piece, because the ability to share data, to increase the transparency of data, to ensure that we are all working with sort of, if not the same targets and metrics, then ones that speak to each other and tell the full story. So really appreciate that. We're coming to the end of our session, and so I want to make sure that there is a chance for each of us to give some final advice to attendees. And so, John, why don't you go first this time?
Sure. No, I so appreciate that, and it's been great. This is, as you can hear, I could probably talk about this stuff all day, as all three of us could. I think the advice that I would give is you're in a really important position, whether you work at a community-based organization, whether you're an individual advocate, whether you're someone who's a job seeker themselves, or whether you're working in state or local government, it's going to take all of those folks being at the same table to really get this policy right. And I think it will be no surprise to this audience that not just listening to, but putting people who've got lived experience of incarceration at the center of the development of these solutions is going to make sure that they, that these solutions are actually workable and actually successful. I think when and I've worked in government agencies at the federal and the local level, when one government agency is trying to work with another government agency, I think the focus is on how do we get this to work. And I think which is right, the focus that you all as advocates and others can bring to the conversation is how do we want this to work? Because there is a lot of give and take there, and a lot of opportunity to actually continually make sure we're centering this around people's needs, not just around, how do the systems work together. That's a means to an end, but the end is people's actual needs.
Thank you, John. Amanda, your final advice?
Yeah, so I might be sounding like a broken record at this point, but really I want to say to get involved early. You all are subject matter experts, and many colleges are just getting involved for the very first time. And even if they've been at this for a while through Second Chance Pell, these regulations are still so new that even the colleges that have been doing this aren't experts on this. And so really, be a resource for them in whatever capacity you can, and develop those partnerships. I also want to say that Ed has really tried to instate these regulations, like I said, because they are trying to make sure programs are operating in the best interest of students. But there's so much gray area on what that actually means and what that looks like, whether it's actually playing out in reality. So your expertise can ensure that students are getting the quality they deserve. So again, on the corrections front, have those conversations early while those evaluations are required at the 2-year point. We're actually trying to suggest to corrections right now to do a year evaluation that's optional, so that you can give a college time to fix it rather than pulling a program if they're not meeting those best interests. And so getting involved early you can help all parties involved and required in this process. Lastly, I already gave a plug for one report. Want to actually just mention that metrics report on how each states are doing. That could also show you where you might be needed. So if they're not doing the best on continuing their education post-release, or they're not doing the best on programs from men's facilities to women's facilities, maybe you're a CBO that emphasizes supports for women. That could be an area, but that mapping will give you an idea of where there are gaps and where you might be able to assist. And the other plug I want to do is for a second report. We're hoping it's coming out in mid-July, but we actually align the top growing, good paying jobs in each state with licensing barriers. So it'll kind of be at least a preliminary one-stop shop to understand where the good jobs are with the degrees people can receive. Please use this information. It's not always easy to find out what licensing restrictions and barriers there are. It's also really easy to just prioritize any job for the people we're serving, but that doesn't lead to economic mobility and advancement. So we really encourage you around mid-July to really take a look at this. Especially for those who are emphasizing or focusing on workforce development, because this could be huge for informing the work that you do, but also maybe nudging colleges and corrections to take stuff like that into consideration as well. Now I'll stop there.
I love those plugs. Thank you so much, Amanda. Very briefly, I will say that if I have final advice, it is, we've all heard the saying, if you want to go fast, go alone. If you want to go far, go together. Our work often, unless you're an intermediary, doesn't create a lot of space for universe building and partnership development. And yet the universe that impacts people with records is so complex and so vast. So continue to come to webinars like this, continue to get connected to coalitions and collaboratives that we can't all do everything, but we can all help each other do the work really well. So in wrap up, I will quickly say that a couple of themes I pulled from today are that this is a shifting landscape, that there is lots of good stuff coming and it's taking time and it's going to come to different places before it goes to other places. And not everyone is going to have access to everything all at once. And we will continue to think about how we can leverage our advocacy and our voices to encourage our states and our regions to advance this work that is going to have such great impact. And then also that CBOs are the subject matter experts and the connective tissue with the real ability to partner with the folks that may have the resources and the funding to make this a reality and to make it a useful, meaningful intervention for folks. So thank you all so much for joining us today. Thank you to John and to Amanda for being on this panel and for being in conversation, and to Kim and the NRWC team. And I will turn it over to Jason.
Awesome. Thank you so much, Randy, Amanda, and John. Your insight was so valuable today. I think John mentioned this before. It seemed as if you could go for another hour in this conversation. So I wish we had more time, but yeah, thank you so much. Thanks everyone for coming today. Just two quick things before you leave. I do have to share that if you have been on our listserv, you may have received information that our conference is coming up in October. We're still in the early bird registration period. The conference will be October 15th to 17th. It will be in Denver at the Hilton Denver City Center Hotel. We're really looking forward to seeing you if you're able to join us. We had a ball last year in Philadelphia, and we're really looking forward to elevate what's really working in the field and get a chance to really connect with like-minded persons all across the country. A matter of fact, you may even get a chance to meet our panelists that are here today in the session. Another thing is our next Thought Leadership Series webinar will be on September 6th at 1 p.m. Eastern Standard Time. So we're really looking forward to that. You will get an email from us when we announce the topic. So stay tuned, we'll have more there. In a moment, you are gonna get a pop-up on your screen with a survey. We'd love to get your feedback on the session. So again, thank you so much for coming. And again, thanks so much, Brandy, Amanda, and John for investing the time. Really great working through this process and getting to this point with you. All right, take care, everyone.
Take care, thank you so much.
Thanks, everyone.
Thank you.